Welcome back to the Better Health Now podcast. Today, I have the opportunity to sit down with Dr. Bitterly, a board-certified general surgeon here at Cullman Regional. Thank you so much for joining me.
No, it's great to be here.
Yeah, I'm excited to talk a little bit about the topic of wound care. But before we dive into that topic, I want to talk a little bit about your background and your journey to get here to Cullman.
All right.
Talk a little bit about kind of where you decided to pursue your undergraduate and then medical school. And is medicine always something you were passionate about and knew you wanted to pursue?
I think I'm going to say, yeah, I when you're in school, you kind of want to be like the first president, first female president, first astronaut, all these things that they, tell you that you can aspire to be. And doctor was on one of those things, or was one of those professions on my list of things I considered. But I remember in third grade, I had a little picture. It's like, what do you want to be? And so you like cut out, a nurse or a doctor. And actually I thought I wouldn't be a nurse to begin with.
Okay.
But as I continued on school, in high school, there was a HOSA program. I got involved in that. And I'm originally from Texas. And so that's one of the programs they have for high schoolers is HOSA and then also CNA. So I did a course and became a CNA while I was a sophomore, junior in high school and worked at a nursing home. So I did the changing in the bed. So started from real bottom up, ground level. And my mom also at the time had always talked about becoming a nurse. So while I was in high school and became a CNA, she actually went back to nursing school. But during that time, I kind of figured out that, this is not really what I wanted to do. A little bit, I couldn't answer the questions. I had a lot of family while I was working as a CNA have questions about very in-depth things about medical. And I was like, I don't know. You got to ask someone else. But I was inquisitive and I was curious and I wanted to know. So then I entered into the HOSA program. And so by the end of high school, I kind of was like, hey, I think I want to go to medical school, having no idea or anybody in my family who was in medicine, involved in it. So completely blind. Had I known, maybe I would have gone. I was like, if I knew I had to take tests for
2020, you would be like,
if I had to take those many tests, I would have been a little hindered. But I would do it all over again. I absolutely love my job.
Yeah. And so what was the sort of the steps along to get here to Cullman from Texas?
So let me see. I went to UTSA for undergrad. Go Roadrunners. We have a football team now. Very exciting. And then after that, I interviewed at all of the medical schools in Texas. And then I ended up getting accepted to the UT Health Science Center in San Antonio. So it was nice. I didn't have to move. I was in San Antonio for 8 years, which was really great. But when I was in there, I had a friend of mine who told me about the military program. And so it was HPSP program. It was year for year. And so I ended up going to a recruiter and talking to them about it. And they signed me up for that. And that's how I ended up in the military. It was kind of one of those, didn't really know where I wanted to go after Texas or what I wanted to do, but I knew I wanted to travel. I wanted to go somewhere. And the military definitely will take you places you do not expect to go. Yeah. So
is there places that you went during your time in the military that was maybe the most unique or the most fun, or places that you never thought in a million years you would ever be visiting or living at?
For sure. One of the places I really had no interest in going was Mississippi, and I ended up getting a residency there. So Keesler was my first base or station. After I was done with medical school, I interviewed and got a surgery. Actually, I did a prelim year in North Carolina. So I went to Raleigh, North Carolina for a year as a civilian. And then I came back and got a categorical spot, an actual program spot in the military at Keesler. Keesler was wiped out by Katrina. It's in Biloxi. So in 2005, Katrina wiped it out. What I didn't know, they said, we have a lot of rotations, a lot of away rotations. So there's home base. There's your home hospital when you're in residency where you do all of your stuff and all your training. And then sometimes once a year or in a certain year from years 1 through 4, 1 through 6, depending on what specialty you specialize in, you can sometimes go on a quote away rotation, which is either in a different city or a different hospital. Well, Keesler, they said, one of those rotations is Germany. And I was like, that's cool because military, we get to go to different bases. So I was like, I would like to travel more. What I didn't know was that because of Katrina wiping out the entire hospital, that they had to contract with all different hospitals across the Gulf Coast in order to fulfill our certification. Basically, in order to become a surgeon, you have to meet certain qualifications and do certain surgeries and certain numbers. So I rolled into this this residency program, and they said, "Oh, by the way, your first rotation is going to be in Jackson, Mississippi, which is 2 hours north, and you're going to be living in a hotel room for 12 weeks with, by the way, your new husband who you just married." So we got real
so not
close.
really Germany, but
but we did eventually in your 4th year. I did get to go to Germany for trauma, awesome. So I was there for about 6 weeks and got to travel across Europe.
Wow!
And then my first station after residency and going all across the Gulf Coast, Destin and Pensacola and, all these places was Japan. So surprise, wow. that was a shocker. So I lived in Misawa, Japan for 2 years. And you think of Japan, you're thinking Okinawa and tropical. So I was ready for some warm weather. I did not know, coming from Texas, knowing nothing about snow, that Misawa is an hour away from the snowiest city in the world called Aomori. So we learned a whole lot about snow.
Wow. Yeah. So I bet all the attire you never thought you were going to have to wear, you were wearing all the time.
Yep. So it was an awesome experience, though. I wouldn't change it.
Yeah. So diving into the topic of wound care is an area of medicine that most people really aren't really aware of unless they've had a family member or they themselves have kind of been a patient. Start off by first explaining what it is.
So wound care is basically what it sounds like. It's a care for a wound. So we use different modalities, different therapies to help heal out usually chronic wounds, but it doesn't necessarily have to be a chronic wound. It can be sort of a subacute thing. So for example, some people will have surgeries and the surgeon is done with their part of the problem. So if you had like a fractured leg or something and they had to go in and or a fractured femur, they have to go do surgery on it, that they're done with that portion. And so your bone is good, but maybe the incision opens up and there's a wound there that's now exposed and the surgeon's done with their part. A lot of times they'll send them to a wound care center because that's going to take more than just a one-time visit to heal up. It's going to be more of a long-term issue.
So you talked a little bit about the surgeries and sometimes that's when the wound becomes sort of evident and that's when patients kind of see that. Is there any other sort of common reasons that patients would need the wound care as they're going through that either that you've seen or that you've experienced with your patients?
Oh, sure. The most common thing that we see is going to be chronic wounds. So that was more of a subacute, acute picture. Most people actually come to us are for underlying chronic wounds. So for example, grandma was out cutting the yard or doing her gardening and she tripped over a rock and injured herself. And now that wound, she went to a primary care doctor. The doctor says, well, I've done all the stuff I know how to do and it's still not healing. They don't really know how to get it better or what to do. So a lot of times they'll send them to our clinic and we'll see a lot of venous stasis issues, people with poor venous flow. They get a lot of swelling and there's a lot of underlying problems that contribute to a wound not healing. So we take responsibility for those patients when the primary care physicians have kind of extended themselves to an area that they're not familiar with.
So for patients who have these problematic wounds, what are the benefits of receiving care from a physician or a clinic specializing in that treatment?
Well, specifically, or generally that, I think a lot of times the benefit is both for the patient and for the physician. I think there's a lot of people who are in the medicine world that you learn about it, but you don't really, or you dabble in it, but you don't really do it all the time. And so you get to a point where you've extended your knowledge and your ability or even your resources. There's a lot of things that we use in the clinic to help aid the wound to heal that primary care or other physicians just don't really have. And so that's one of the benefits that the wound care center offers, especially ours here. Two, you have a lot of really knowledgeable nurses and staff that are very involved in the wound care. Specifically here, I think that our nurses do a fantastic job of routing and navigating the insurance and the payments and helping the patients with home health care, a lot of things that, in medical school, they don't really teach us to do. So I rely very heavily on my nurse practitioners to help me do the care and then also help our patients to get through the care in the long term. So that's one of the benefits. The other benefit is we have a lot of items that clinics cannot gain access to, or it's expensive to gain access to, or it's just difficult to get. And so the wound care center is able to hold some of those items there to apply to the patient patients. We also are very involved and very close to our physical therapy, where our physical therapists offer lymph therapy for a lot of these venous wounds. So it's not just a lone man standing. We're not a lone wolf. We have a lot of help around us. And so it's more of a multifactorial, multidisciplinary center that really helps in the long term the patients to heal their wounds.
And I know you alluded to a little bit earlier, but just the wound care here at Cullman Regional, and it is expanding and being able to offer it to more people and have more rooms. How will that expansion kind of continue to aid in the support of wound care patients here in Cullman Regional, and kind of what does that forward looking look like?
Just the sheer volume. I don't think there's a whole lot of wound care centers near our area. And so we just get flooded with a lot of patients who have a lot of chronic wounds and a lot of need. And so the rooms opening up allows us to see more patients in a shorter amount of time, just to be able to just treat their wounds in general. So
talk a little bit about how hyperbaric oxygen treatment works with wound care.
So hyperbaric oxygen is, let me break it down. So hyper meaning a lot or more increase, baric meaning pressure, and then oxygen is oxygen. So it's increased pressure oxygen therapy. So two very important things for wound care are going to be flow, both the venous and the arterial flow, and oxygen. Okay. So what we do is we don't really do a lot with the venous flow. We do therapies to help that, but we work very closely with vascular surgeons and with venous specialists to help people who have areas of issue in that department. But what we can provide is the hyperbaric portion of that, which is the oxygen portion. And so the hyperbaric chamber, it increases the pressure to allow more oxygen to get to that wound, which is the second portion of the healing.
Which wound care patients can benefit from the HBOT?
There's a lot of different eligible patients, including anybody who's had radiation and have complex wounds from radiation therapy. The one that we see the most of, then the most common, is going to be your diabetic wounds that are not healing from diabetes. And there's different situations, but one of the most common things we see is people who come in with a diabetic foot wound because they can't feel their feet. And so, and by the way, that's very important. If you have diabetes, please check your feet every day. It's very, very important for foot care. But a lot of them, the wounds will not heal, and that will start deteriorate and break down to the bone, and then you get a bone infection. And the textbook answer is, if there's a bone infection, you either have to treat with chronic antibiotics. If that doesn't work, then you usually amputate. Okay. And nobody wants to lose toes and feet, but that's sort of the nature of the beast, unfortunately. Wow. So hyperbaric therapy is sort of this intermediate between that, where if they've been on antibiotics, they are a diabetic, then a lot of times they can qualify for hyperbaric therapy, which can help treat that. And we are very big into limb salvage.
So talk kind of like, as we kind of sum up the conversation on wound care, talk a little bit about maybe some questions that you see your patients, or maybe that questions that maybe you think patients have when regarding wound care that maybe you can answer for them that are the most common.
That's a good question. I didn't really think about that. A lot of people have questions about, they don't understand. I actually don't like that. That's a lot of hesitation. So let me start over. So some of the questions that people have, or some of the misunderstandings that people have about wounds, I think is the most common thing. A lot of people will come in with a wound and they don't understand why it's not healing. And a lot of the questions that we answer are geared towards their underlying medical problems. So for example, we see, like I said, diabetes is one of the most common things, or venous stasis is the most common thing that we treat. And a lot of people have questions about, they understand that their sugars are elevated, but they don't understand the significance of keeping their sugars under control. And so we answer a lot of questions in regard to that, as to like, yes, your sugars need to be under control because that's going to prevent the wounds from healing. That diabetes is a small vessel disease. So even though their blood flow is flowing, so they'll have an injury and they'll say, well, I'm bleeding. Well, yes, but your small vessels are the problem. So we answer questions in that nature. The other thing that people have questions about is for venous stasis is the involvement of they don't understand why we're wrapping their feet a lot of times. And so some things that we'll explain is that the swelling prevents the wound from healing, that, it takes longer for the important factors to get to where they're going. So if you compress the wound and wrap the wound, then that will allow for the wound to heal.
Well, I think like it's an area that I obviously had no knowledge about wound care prior to this. And I think, the explanation and kind of just the areas in which maybe patients or people listening or watching that, maybe fall into any of the categories that we've kind of mentioned, having a better understanding prior to coming in. I think that's probably the biggest thing too, is like, if you're well informed prior to coming in to talk to a physician about anything like this, and also like for the patients too, I mean, being willing to ask questions and like, and as they're going through this process. But I appreciate you being here today. Talking a little bit about wound care and kind of your journey all across the world to get here to Cullman, and then the impact you've had here in Cullman, I think is going to be incredible in your patient's life. And I continue to look forward to the impact you'll have for years to come. But thank you so much for being here.
Awesome. Thanks for letting me be a part of this.